Good afternoon. Thank you for coming out today. I'm excited to present to you my proposed thesis work. For my work, I'm looking to develop a health education program for Indigenous middle school children in rural Saskatchewan using the child-to-child approach. I would first like to tell you about a similar program in India that we're looking to adopt to Indigenous youth in Saskatchewan. These pictures are from a community in the rural, remote, hilly regions of Tamil Nadu in India, and it has about 17,000 people living there. The residents of these places have very low incomes. They do not have any hospitals nearby and also have very high infant mortality rates. In 1986, two physicians, Drs. Rajkumar and Mary Ramasamy, started a program called Little Doctors, where they trained social workers in the community to go to schools and teach children about their health. The idea was that children would in turn share this information with their families and their communities. The objectives of the program was to develop a health education program for children in grades 5 to 11, give them simple preventive health care measures, and essentially empower them as health advocates in their own communities. Here are some examples of the topics of instruction. The students were taught about general health as well as diseases prevalent in their communities. Some of the examples are germs, sexually transmitted diseases, leprosy, dental hygiene, eye care, cancer care, etc. The instructors, in this case the social workers, used innovative and engaging methods of instruction. On the left is a slide from a PowerPoint presentation, and on the right is an image from a flannel board that they were using. The information was available in both English and in Tamil. Finally, the students who finished the program were given certificates that called them little doctors in their communities. This program was not intended to be a research study, so there is no empirical data about the outcomes, but the community members were very happy about the program, and it's being increasingly adopted by NGOs in different parts of the country. Little Doctors is an example of the child-to-child approach to health education. In this approach, children are trained as advocates in their communities, and they're educated about diseases that are relevant to them or health in general. And this program is widely adopted in developing countries, and it's used for health education pertaining to different topics. For example, in Turkey, it was used to develop a program to prevent school injuries, but in Tanzania, it was used for eye health screening. So how can we use this program as a framework and adopt it for Indigenous youth in Saskatchewan? The objective of this proposed study is to develop, implement, and evaluate a pilot health education program for Indigenous middle school students in rural Saskatchewan. The program would be primarily informed by traditional ways of knowing and supplemented by Western worldviews. Here are some things that we must absolutely consider in program development. It should use a decolonizing lens and be strengths-based. It should primarily be informed by traditional ways of knowing and merely supplemented by Western worldviews. And every stage should actively involve community members and elders. This study has the potential to engage children as advocates in their community. It could also build capacity in terms of future career prospects for them. It would definitely strengthen their cultural identity and increase community cohesiveness. The framework that will be used to develop this program is called the Aboriginal Ways Tried and True. It situates the student in the context of their family and communities and also looks at health from a holistic perspective. The first step would be to form a curriculum development team. It would involve members from the chief and council, school instructors. After building a meaningful relationship with the community, the first step would be to understand the needs of their community in terms of the program that we wish to develop and understand what the intervention might look like. It could use a combination of instructional methods, even technology. The proposed study design is a concurrent mixed method study that primarily involves sharing circles as the means of collecting data, and this would be supplemented with in-depth interviews and also surveys and questionnaires. Ultimately, in terms of knowledge translation, the students could present their work to the community in a way that they choose, and the instructional material that we develop can also be adopted to different communities in the area. I'm really excited to get started on this project and to look at health education from a decolonizing lens and truly become an ally.